Welcome to BioBalance Healthcast. I'm Dr. Kathy Maupin.
And I'm Brett Newcomb. And normally on these podcasts, we talk about various elements of hormones and hormone replacement conversational topics because we're trying to understand the puzzle of hormones and the way that they work in the bodies. Today we're not going to talk about testosterone. We're going to talk about another element in the puzzle. We're going to talk about the thyroid, because what has emerged is a lot of information that says that the thyroid, and whether it's under-functioning, over-functioning, or appropriately functioning, is just as critical in healthy, stable life after menopause. And so we want to talk about the thyroid because a lot of times issues with the thyroid are not diagnosed, they're not identified. Sometimes the lab results don't give a clear picture or an accurate picture. I mean, there are a lot of issues that can occur. And the reason we decided to talk about this today, April 23rd, just 2 days ago, a report came out in the Archives of Internal Medicine looking at subclinical hypothyroidism and fatal or non-fatal cardiovascular events. So first, let's define some terms. Yeah. Talk us through hypothyroidism, hyperthyroidism, and subclinical. What do those terms mean? Okay.
Hypothyroidism is a very low thyroid. Your thyroid's in your neck. It runs your metabolism. It runs how warm you are, how you metabolize your calories.
So I'm not really fat, I just have a low metabolism.
Yeah, see? Or your thyroid's low, causing that. And thyroid patients who have a low thyroid have swelling all over. They look very swollen in general. Or they also have a very slow intestine, so they usually have constipation, unless they have some other GI disease. They also gain weight rapidly and don't lose it. They feel cold when others are hot. Their basal temperature is very low. Usually they stop having periods or have irregular cycles if they're premenopausal. They have infertility. And the thyroid manages everything in your body. It's not as universal as the pituitary that runs every single gland in your body, but the most universal gland is thyroid. Thyroid takes care of every cell in your body, has receptor sites on every cell. So having a thyroid that works optimally is very important to your lipids. Your cholesterol goes up if you have low thyroid. So if you have high cholesterol, in the old days, we used to check for high cholesterol with a low thyroid when we got results back that showed a low thyroid. And if the cholesterol was elevated, we treated the thyroid and the cholesterol came down. So it affects everything.
And now they just treat the cholesterol.
They just treat the cholesterol instead of looking at the thyroid, which is bothersome because it's not really treating the problem, it's treating the symptom of the problem.
Yeah, it's like putting a gas additive in your car to get better mileage instead of tuning your car up. That's
right.
Yeah.
That's right. And thyroid affects so many other things. They could, kill 20 birds with one stone. They could help people lose weight. Doctors could actually tend to what's really bothering the patient, which is I can't lose weight even when I exercise every day and eat very little. That's really what thyroid patients say.
So medicine by symptom management is more expensive.
Well, if you're just looking at one symptom.
Right. You treat that one and then come back for the next one.
That's right. It is. It is. And it's many more drugs because cholesterol drugs are very expensive and thyroid is very cheap. Right. So for us to actually treat symptoms and prevent illness, it's much more economical to treat with a thyroid medication if that's the problem. Now, hyperthyroidism is different. Okay. Hyperthyroidism is the reverse. Patients are very nervous and anxious. Their heart rate goes up. They lose weight quickly. They're hot all the time. They move around. It's almost like an ADD kind of thing in general. And
they're wired.
They're wired. They're wired.
It's on overdrive.
But it's not a psychological problem. It's a thyroid problem.
Yes.
And oftentimes it's misdiagnosed because if you don't take a temperature, you can't find a fever. If you don't test the thyroid, you can't find hyperthyroidism. But when it is found, then usually drugs are given to shut it down, and or radiation's given.
Well, but you just used some terminology. You're talking about testing it because earlier in the conversation, you're going through a list of symptoms that come out of a clinical interview. If you sit down with a patient, you say, tell me what's going on with you. Are you constipated? Do you get cold easily? Or other people that are, and you go through this checklist in your head that tells you as an experienced physician, I need to be looking at a thyroid problem.
Right.
Then you get a lab test, but sometimes the lab tests don't say thyroid problem, but all the symptoms do. So what do you do with that?
Well, that's called subclinical hypothyroidism.
Okay, well,
when the lab test,
that's what we're talking about, oddly enough.
And it also, inversely, it is that if you have a thyroid test that shows hypothyroidism but no symptoms,
right,
this study says that should be treated as well.
Okay.
So lab tests that show hypothyroidism without symptoms and symptoms without the lab tests are considered subclinical, and they should be treated.
Okay.
And they should be treated for many reasons, but studies have to be honed down to usually one variable. And this variable was the rate of heart disease, and can replacing thyroid, the question they wanted to answer was, can we prevent heart disease and heart attacks and fatal heart problems by replacing thyroid? Now that's very conservative in terms of money, and that's for the patient, that's awesome. That's preventive medicine. So that's what this study was asking. That's the question they were asking.
For hypo, not for all thyroid, for
no.
hypothyroid.
And there's lots of other diseases that you can have associated with the thyroid, but we're talking about a slow or low or inactive thyroid. And that's what is most dangerous in terms of heart disease.
Okay.
Okay.
So they're trying to isolate the variables out and say, in terms of looking at heart disease issues, either fatal or non-fatal heart disease, and we'll differentiate among those in a minute and why they're concerned. But if we're looking at heart disease issues and we identify one variable, the thyroid, if the thyroid is underperforming, is there more likelihood of a heart issue over time? And if you treat the underperforming thyroid, do you alleviate the risk of the heart issues?
Right, because when you do a study, just because you find out that a low thyroid causes this doesn't mean that treating that low thyroid will prevent it.
Right.
So they were
it could be a corollary as opposed to a causation.
Right.
It could be just simultaneous events.
Right, but they proved.
So they're looking for the linkage.
They look for the linkage, and that's very good. That's a very good study to look for the linkage. And they found that not only does hypothyroidism cause non-fatal and fatal heart disease, or heart events, but they also found out that by giving and replacing thyroid to an optimal level will also prevent this. And that's very important because then it added the variable of thyroid and heart disease and tied them together because now we can prevent it.
Right. And we can, and fairly inexpensively and fairly easily, because thyroid medicines are not that expensive and they're pretty easy to take with side effects not being an issue. And so then it strengthens or increases the odds that you won't have an ischemic, is that right? Ischemic heart disease.
Ischemic means that you have hypoxia or no oxygen going to the heart itself. Usually that means a blockage of a blood vessel with atherosclerosis or cholesterol kind of deposits. But it can be any kind of low oxygen level that causes damage to the heart muscle.
Okay. So obviously, I think obviously, fatal heart disease is self-explanatory, and we know why that's an issue. But what about non-fatal heart issues? What's the concern there?
Well, most people don't realize that when you have a heart attack means that part of your heart muscle has been damaged. The vessel going to it was blocked so that you could not get enough oxygen to an area of the heart. There are many vessels that feed the heart. Even if one of them is blocked, it can cause that muscle to die. And the heart muscle depends on an entire circumference of muscle squeezing, right? So if part of that doesn't squeeze as well, then you end up not getting the blood flow to your legs, not getting it to your brain, it decreases your cardiac output. It makes the work of the heart harder. What's present and accounted for has to work harder to get blood to the rest of your body. And your kidneys won't work as well, you won't feel as good, and you'll be tired. So oftentimes, if you have a non-fatal heart attack from lack of oxygen to the muscle, you're debilitated.
Right.
And that's a terrible outcome to have, especially after menopause, especially even in men who are older. Their testosterone's down, women's testosterone's down. By the time we usually have heart problems, we're postmenopausal, post-andropausal.
Yeah, typically.
And then the muscle doesn't grow back.
Right.
And so then we're left with a life that is confined to a chair, you can't exercise, you may have to use oxygen. And that's a terrible way to live, and it takes productivity away from us. It takes the joy of life and the joy of just being able to produce something, go to work, or take care of our kids. So that's a huge deal. And if we can prevent that through giving levothyroxine, which is the generic of Synthroid, or Armour Thyroid, or Cytomel. There are many different forms of thyroid. They just use levothyroxine in their tests because it was a generic and the most inexpensive. But if we can use that, and if we can replace what's missing in terms of our other hormones like testosterone and estrogen, then we have a much lower risk of dying of heart disease or even damaging our heart, because it's also known that testosterone helps us repair the heart even after hypoxia, which is low oxygen. So we are able to then take what we know and add it to this to create the most preventive situation for a patient. Give them back their thyroid, give them back their testosterone, give them back their estradiol if they're women, and then that puts them in the best place to resist having a fatal or non-fatal debilitating heart attack.
Right. So the quality of life is a factor here, because you tend to think heart attack, oh my God, people die. But most heart attacks people don't die from.
Actually, I'd rather die than have a debilitating heart attack, because that would to me, that my life would be over as I know it. You know, and that would be very, very difficult. But with the fact that I take testosterone and I take estradiol, that would help me recover from that. In fact, I have one patient who is male and is 64, and he had a terrible heart attack, and had just started taking testosterone, and he had it damaged so much of his heart that they said he would only get a certain percentage of his old cardiac output back, and he wouldn't be able to exercise, and he may not be able to live his life.
And his cardio doc, looking at what you proposed for him, looked at it from the standpoint, is what Dr. Maupin wants to do going to cause any damaging side effects? And he couldn't find any, so he said, well, I don't see how it's going to hurt him, but I don't believe it's going to help him. And so you put him on this treatment protocol, and how did he change?
Which was continuing to replace his testosterone. We had already started that, but he hadn't been on it long enough to protect his heart.
Right.
So when he had this heart attack, and he said, I really want testosterone. It makes me feel better. It makes me leaner. It's going to help me recover. He didn't really think about the heart muscle. He thought about all his other muscles.
Right.
But in fact, what it did was it helped him repair his heart muscle. I mean, it was amazing. And his doctor, I sent all of the research. I sent tons of papers so that his cardiologist could make a decision of his own. And I waited on that decision. And then I know him also socially, and I see him out, and he is just as energetic and awesome as he ever was. But his heart...
Your patient, not his doctor.
No. I'm sorry. My patient.
Yeah.
And his doctor is amazed, shocked. He's never seen anybody with the damage that he's had actually come back to normal, and he's normal.
Yeah.
So,
and the reason we're talking about this part and have shifted back into testosterone and testosterone replacement, the study that was reported in the Archives of Internal Medicine did find a positive uptick in treating hypothyroidism in younger patients. But for those 70 and older, the incident of heart disease issues didn't improve.
Right.
And so it didn't get worse, but it didn't get better. So what they said was, if we catch you young enough and we treat your thyroid, we can avoid or delay these events. If you're older, then we can't say the same thing. We don't know what to do with that, but we can't say the same thing. And your argument is, if they replace in the elderly population that replaces their testosterone, their overall quality of life and muscle strength will get better.
And muscle of their heart
will get better. And particularly the muscle of the heart, because this man is a good example of that.
Yeah, he's an excellent example, and one that I'm hoping to see more patients from this cardiologist who now has seen it work, sending me patients who I can then help get back to their usual life, because you know, we identify with patients that we're very much like, and the patients that come to see me want to be productive, and they want to go back to work, and they want to exercise, and they want to have a healthy life. So they're looking for that, and I don't want to have a heart attack or something devastating like that impair them from their life. They need it all. They need their thyroid if they've lost it or if it's decreased. They need their testosterone, and they need estradiol, because estradiol is also cardioprotective.
You know, it just has to be phenomenally pleasing and comforting to you to be able to make that kind of an impact in somebody's life.
It does.
You know,
I mean,
this guy comes in, he's nearly dying, he's not able to walk, he's not able to exercise.
He literally looked gray. I mean,
yeah, his skin color is off because his oxygen content is off.
Right.
And in a few months of treatment, he's walking, he's exercising, his color is good, his heart muscle is stronger.
He was dancing to the Beatles last time I saw him. And he was amazing.
Yeah.
So he looks like he did, actually he looks better than he did because he lost weight. This scared him. He lost more weight.
Yeah.
And so he looks even better than he did, you know, 3 years ago.
Right.
So this study for me is documenting what I've always believed, that if someone has symptoms of thyroid without the lab,
right,
or lab without the symptoms, they should be treated. And there's many more reasons. Losing weight and decreasing your swelling and decreasing your cholesterol.
Regulating body temperature, comfort,
yeah,
all those things. And you know, it's not a new topic. I mean, cardiologists are looking at it now, but gynecologists were looking at it as long ago as 2006. You were talking about a study in the gynecological journals about hypothyroidism, but you had an interesting twist to your understanding of why they were looking at it.
Well, in OBGYN, the center of attention is on fertility and on young women. And the question was, should we even look for low thyroid in young women? And it was for fertility.
Yeah.
Because if you have...
So if you're not fertile, or you're not trying to be fertile, then they're not as focused on or concerned about you?
I mean, I'm an OBGYN. I'm board certified, and I'm a fellow in the American College of OBGYN, and I had very little training in postmenopausal care, and it was just give them hormones or don't give them hormones. That was it. And it wasn't, and hormones meant estrogen and progesterone or just estrogen.
Right.
So it didn't
mean thyroid.
It didn't mean thyroid, and it didn't mean testosterone.
Exactly.
And there was very little about caring for people after the age of 40-something when they stopped reproducing, because we do deliver babies and we treat infertility. And so that's primarily one of the things we're trained to do, and we have lots of hours in those areas. But we have very few hours in clinical management of the menopausal patient. And when I read this study and I pulled it because it was hypothyroidism, and I treat hypothyroidism of all ages, and I always have, because I've had the problem myself since I was in my 20s. So for me, this is a near and dear subject, and I've read all the literature on it to make sure that my being replaced was proper, and being replaced does solve all my problems. All the symptoms of hypothyroidism, I can always tell if I didn't take my thyroid. In a day, I'll know if I have those symptoms. So this was a big topic, but it is not just big for people who are trying to have babies. It's big for all of us, and it's a huge impact on how we live daily and how we're going to live when we're older. So for me, looking back at 2006 when Contemporary OBGYN looked at this, they have all the right information.
Right.
But they don't have the information that's centered on postmenopausal thyroid replacement. It's more about women who are cycling, because you can stop cycling altogether if you don't have thyroid. I mean, women stop having periods.
Yeah.
That's one of the signs in young women that they have a hypothyroidism.
They stop, or they have breaks, and you have a period, and it's 3 months, and you don't have one, then you have another one, or they just stop.
It affects ovulation. So in general, ovulation is what stimulates a menstrual cycle. So without thyroid, they tend to not ovulate, therefore not have a period for months at a time and then bleed heavily, or they have irregular bleeding all the time because
Right.
there's no ovulation, there's just estrogen production,
Right.
there's no progesterone, and so they're just bleeding all the time. So it's an irregular cycle, and that makes it very hard to get pregnant if you're not if you're not making an egg every month. But the signs are very upsetting to patients because they see this and they're put on the pill in general just to give them a period, just to manage that. But they're managing, once again, the symptom
Right.
and not the cause.
Right.
And it can be just without hypothyroidism, you can have irregular cycles, but at least it should be evaluated. And that was one of the things they were looking at. Should we look at this?
Yes.
And of course, they came up with the conclusion that they should.
Well, as long as they're looking at fertility.
Right.
You know, in women who want to be or are expected to be capable of getting pregnant.
That's primarily the interest.
And now we have an interest for people that are getting older who aren't looking at getting pregnant, but who are looking at avoiding heart issues, general debilitation, general decline, that whole cascade of aging deficits that lessens quality of life and survivability.
That's what we're here for. That's what we're here to open the door to all of this research that's out there, but no one's really talking about.
So if you are interested in learning more about this, if you have questions and you want to contact us generally, you can certainly do that.
You can go online to podcast@biobalancehealth.com, or you can go to my website at biobalancehealth.com, or you can call my office at 314-993-0963.
And you can always reach me at brettnewcomb.com.